Hello, good surgeons. Let's watch this case. This is a chain of unfortunate events that happen in this case. So two paracenteses are being made, and main one is coming in. To start with, this is an intramedullary cataract. So we're gonna do the double axis technique. First axis is gonna be around 3 millimeters. So we're gonna bring the IA and try to debulk the nucleus a little bit and try to aspirate some of that swollen cortex. After that is done, we're gonna grab the venous scissors and we're gonna run 360, a good axis size, and then we're gonna continue this case. So the moment I started the hydrodissection, I noticed that the zonules are very weak, and the whole lens and the back complex is wobbly and is really with the poor sufficient support trying to crack this nucleus, but since there is no counter pressure from the zonules or the lens equator, there is difficulty in cracking this case, and even rotating this nucleus is going to be very difficult. So we're going to try to dissect this nucleus as greatly as possible, and then to get a better support during this phaco, we're going to insert CTR even before removing the nucleus, and making sure that we create some space with viscoelastic in the peripheral bag just to accommodate this CTR. Now this is preloaded CTR. Let's inject it with the injector, but unfortunately at this point, while injecting the CTR to the far periphery in the bag, the other end of the CTR is just stuck here at the injector hook. No matter how many times I tried, like with the chopper, to release it or unlock it, and then it doesn't work. Maybe some glue is stuck at the tip of the injector or that hook. You can see like my right hand still holding the CTR in place, but still refusing to come back even with the Sinski hook. So best is like I try to retract it from the eye and the capsular bag, although like I was very disappointed at this point trying to get this CTR out of the injector and insert it manually, but it is stuck in between the tip and the hook, trying to manually go and fish it without making sure that we don't bend it or break it. Injecting a little bit of viscoelastic, trying to lubricate it so it can be easily released from that injector tube. Finally it is out, and thankfully it is not damaged. So let's inject more viscoelastic to the peripheral bag and near the equator of the lens, and then create some space to inject the CTR manually. Now as if it was not enough, the bad zonular support, the intumescent lens, the stuck CTR in the injector. Now we're gonna face small pupil and difficult cracking of the nucleus, manually feeding the CTR using two instrument technique, but for some reason it bounced off from the bag. So we have, because of the bulk of the nucleus still like inside, so we're gonna push back like to the far periphery in the equator of the lens, the bag, and then we're gonna gently and firmly push it like into the equator, and only then we can release it with two instruments, with the chopper and the Sinski hook. Now notice the difference that this CTR made. There is much better support and much better stability of the lens and the bag. At least the lens is no longer wobbly. However, now we're gonna face the challenge of cracking this nucleus with the CTR in the equator and removing the cortex from the equator. The pupil is not really helping much, it's constricting. These pseudoexfoliation cataracts are really challenging, and sometimes they are very reluctant and resistant to phacoemulsification. So you have to be prepared to face the worst complications during the pseudoexfoliation cases. Supporting the nucleus with some viscoelastic, and then trying to rotate it with the chopper, and then having it face the phacoprobe, and then gently we're gonna try to chop it to small pieces and then like deliver it to the phacoprobe. Now removing the epinuclear shell. Thank God everything is so stable now, and the CTR did great during the phacoemulsification. And then removing the epinuclear shell, although the pupil is being uncooperative at this point. Notice that there's the pseudoexfoliation material in the pupillary margin. You can tell like how bad the zonular support is just from looking at the pupil margin. and see the debris of this crusty material that is causing all these problems and making our lives so much more difficult during the phaco emulsification. Cleaning up the nucleus matter, the cortex matter, it was a little challenging because the CTR still supporting the cortex, so it was difficult to dislodge. Now the IOL coming into the bag, and this is also annoying that the IOL is haptics are still stuck and refusing to open up. They're like bone dry. However, like pushing it with the IA system manually just to open them has helped a lot. Now trying to clean up like the remaining cortex. Thank you so much and hydrating the side ports, forming the AC. Thank you so much for watching this case, and have a great night.